How is eczema treated? What are the popular topical agents for eczema? In today's video, we will focus on the immune mechanism behind eczema and the most common topical agents called corticosteroids or just steroids. We will be discussing only topical steroids, not the oral ones that are used only in severe cases of eczema flare-ups and usually for a short time. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. In our previous video, the link is below, we started our conversation about eczema and its triggers. Let's delve a little deeper today, but I will spare you, I promise, the dry immunology explanation by offering, I hope, some fun analogies. There are these Th2 cells or T helper 2 cells in our immune system. They play a key role in eczema and other immune diseases by producing specific cytokines. Let's explain cytokines because they're extremely important in understanding the whole thing. Imagine a city where food is delivered by couriers, cytokines, who are responsible for delivering meals, immune signals, to different parts of the city, which is our body. Normally, these delivery people are well coordinated. They pick up orders and deliver them only where they are needed, ensuring that every customer in every part of the city gets the right food at the right time. That keeps the city, our body, our immune system running smoothly, meaning that we have a healthy immune response. Then let's say one day a small problem occurs at the city, like a street festival causing a minor traffic jam. So that is an irritant or an allergen, a trigger. Suddenly, the food delivery service goes into overdrive. More delivery people are sent out than necessary, each carrying multiple orders, but instead of delivering the food where it's actually needed, they start dropping off meals at every single address, even those that didn't order anything. This overwhelms the city's residents, skin cells or our body, with too many messages, inflammatory signals. The result? Traffic congestion, confusion, and too much food piling up at every doorstep. That is inflammation, redness, swelling, and itching. The delivery people, which are cytokines again, are causing chaos, not realizing that they're making things worse. The steroids reduce production of these bad cytokines. By reducing the production of these cytokines, steroids suppress the Th2-mediated immune response. Thereby, they're just decreasing inflammation throughout the body, and especially the skin in this situation. Additionally, there are two other potent inflammatory substances, such as NF-kappa B, nuclear factor kappa B, and activator protein 1. They are responsible for stimulating and causing expression of more cytokines. And topical steroids can inhibit these two substances as well. Steroids may also enhance the activity of this regulatory T cells or Tregs. What are Treg cells? The primary function of Treg cells is to regulate the immune response, ensuring that it does not become too strong or attack the body's own tissues. This is critical for preventing autoimmune diseases where immune system attacks healthy cells and tissues. Tregs essentially suppress Th2 response. They're the good guys. To use our previous example, you can imagine that they're like traffic police regulating the flow of our food couriers during that food festival and trying to normalize everything, trying to make it more normal and stable. Additionally, steroids cause vasoconstriction that narrows blood vessels in the skin and prevents the leakage of fluid. And that actually leads to decrease in swelling and redness. So it's beautiful to see that correlation between the mechanism and the manifestation. Let's look at what exactly steroids do for eczema. One, they decrease inflammation in the skin by decreasing redness, itching, and swelling. Two, rapid symptom relief. That's what they provide. Topical steroids can start reducing itching, redness, and swelling within hours to a few days of application, providing this much needed relief to patients who are intensely suffering from itching. And by quickly controlling these symptoms, topical steroids are very popular, of course, but they also allow people to actually get a night's sleep to engage in their daily activities and just reduce the psychological discomfort of this intense itching and appearance as well. The next thing is flexibility in treatment. Topical steroids are available in a variety of strengths, from mild, such as hydrocortisone, to very potent ones. That allows us, the healthcare providers, to tailor the treatment to the severity of the eczema and also to the area of the body affected. Additionally, they come in all kinds of formulations: creams, ointments, lotions, gels, foams. For example, ointments are more effective for very dry and thickened skin because they provide a better barrier, while creams are preferred for moist and weeping areas. What are the side effects of topical steroids? And there are many, unfortunately. Let's start with skin thinning or atrophy. Prolonged use of topical steroids, particularly the high-potency ones, can lead to thinning of the skin. This happens because steroids inhibit collagen production in the skin, which weakens its structure. Thinner skin is more prone to bruising, tearing, and stretch marks. These effects are most concerning on the areas that are naturally thinner, such as face, neck, and groin. The other thing that they can cause is telangiectasia, which is spider veins. So telangiectasia is development of small visible blood vessels under the skin that could be, again, caused by prolonged steroid use. They can appear as fine red lines, and the thinning of the skin and this effect of the steroids on the blood vessels together, they can lead to this permanent red marks that are, again, cosmetically concerning. The next thing is hypopigmentation, or lightening of the skin. Steroids can reduce the activity of melanocytes in a cell responsible for skin pigment, and that can cause lighter patches of skin in the areas where steroids are applied. Hypopigmentation is more noticeable in people with darker skin tones and can be a significant cosmetic concern. The next one is steroid-induced dermatitis. Overuse of topical steroids can paradoxically cause worsening of eczema symptoms, such as it's called steroid-induced dermatitis. The skin can become even redder, more inflamed, and itchier. Tachyphylaxis is a phenomenon where the skin becomes less responsive to steroids over time, requiring higher dosages or stronger steroids to achieve the same effects. This can lead to a vicious cycle of increasing steroid use. Next one is increased risk of skin infections. By dampening the immune response, topical steroids make our skin more susceptible to bacterial, fungal, and viral infection, and this is due to immune suppressive effects of steroids on our skin. Next one is systemic or body absorption of steroids. Although rare, systemic absorption can occur with high-potency steroids or the steroids that are used over large areas of the body. This risk is higher in children due to a larger surface area to body weight ratio. Potential systemic effects could be quite serious because they would lead to decreased production of natural cortisol, which can result in symptoms like fatigue, weakness, and low blood pressure, and fainting spells, etc. Other effects can lead significant blood sugar level issues. Rebound effect with steroids, that's the next one. Topical steroids, if they stopped abruptly, they can actually lead to worsening when eczema symptoms return, and even worse than they were before. And that's because the skin needs to adjust to being without steroids, and it can no longer do that. What are the guidelines on using steroids? First of all, I have to say that there's 7 classes of steroids, with class 1 being the super potent, such as clobetasol, for example, and class 7 is the least potent, such as over-the-counter hydrocortisone, or just called cortisone. So it's very important to select a correct topical steroid. First of all, selecting the right potency. For example, low-potency steroids are used for mild eczema and for sensitive areas such as face, groin, and also if you need it for longer durations. Medium potency can be used for moderate eczema on body and limbs. High potency is used for severe eczema, thickened skin, or areas such as palms and soles where skin is thicker and harder to penetrate. The next factor is duration. Topical steroids are generally prescribed short-term to be used during acute flare-ups for no more than 2 weeks at a time, and that minimizes the risk of their side effects. The next one is application. A fingertip unit is actually a practical measure that really helps in steroid use. So if you use one fingertip unit, it's like 0.5 gram, and it from the tip of your finger to the crease, and that should be enough to put steroid for the area of the size of 2 adult palms. And it should be applied very thinly without any occlusive dressing, so no occlusive dressings. So in conclusion, strategies for minimizing the risks from the usage of steroids. Use the lowest effective potency, limit the duration, avoid sensitive areas for high potency steroids, monitor for side effects, and use combination therapy because in some cases, topical steroids could be combined, for example, with topical calcineurin inhibitors, with moisturizers and other therapies. We will be discussing topical calcineurin inhibitors in our next video, but for now, that's it about the steroids. Thank you so much for listening. Until next time. Bye-bye.